So then we're going to move on to the next section of Āma. And as we start to look at Āma, there's a big shloka here about Nidana. And remember, the Nidana are the causative factors. And we're going to learn more about the framework of causative factors and disease processes and pathology and all that in the spring. But for right now, you just have to remember that the term Nidana means causative factors, and that these specifically are the reasons for Āma to be generated in any person or any body. Before we read this shloka, which is line number 8 from Shataka Vimanasana chapter 2, we need to put this in context a little bit of where Āma comes from, and that is the shloka in the previous line of that same chapter, line number 6, and that is described in context of Ati Matra, kind of where we left off on Saturday, looking at the lakshanas of excessive quantity of intake. If somebody eats too much, what happens? This is exactly what is explained here in the previous line, line 7. And so we're just going to go through the shloka and break it down and make sure that everybody has understood the sequence of events that happens here, because this is critical to the production of Āma. This is where Āma comes from. He says, Ati matram, so increased or excessive quantity, too much quantity. Punaha, as has been discussed previously, so we're continuing the discussion from the rest of this chapter and really the previous chapter too, chapter 1. Rasa Vimana talks all about how to measure the components of a meal so that the person consumes the right quantity. All of those factors have to be considered. We'll talk about those when we talk about ahara. And then he says, Sarva dosha prakopanam icchanti. Sarva dosha, all of the doshas, prakopanam, undergo prakopa icchanti, immediately. This happens right away. There's no delay. There's no like 3 days later the Āma shows up, or 6 months later because you ate something when you were on a vacation somewhere. Some Āma suddenly appears. That's not how the process works. Āma that is acute and local to the GIT appears immediately after eating whatever it is that's causing that Āma. He says, then kushalaha, from their otherwise normal healthy state, yohi murtanam, when a substantial quantity of food is consumed, the ahara, and this is the key here, it has to be sauhityam. Sauhityam means that it's hitta, which is of course good for the person, but sauhitya is like a little too good. It's a little too enjoyable. One too many pieces of whatever. Dessert, food, anything that pushes a person over the edge. And this is seen as dravais triptam apadyate. So when this is combined with drava, with liquid, there's too much food and too much to drink, that creates this increase in satiation. So remember, we talked about this word tripti last time. Tripti is that sense of contentment. However, it's not true contentment. It's often translated as pseudo-contentment, which means that it feels good, but it's not actually good for the person. There is a whole related group of dravya that work against this feeling, mentioned in Charaka Sutrasthana chapter 1, the Mahakashaya chapter, which we will see in the springtime. But just keep an eye out for this word, because you're going to see it again and again. Tripti, it's an important term. So when we get too much food, too much drink, and too much satiation, it's kind of like a food coma that the person goes into. What this does is it immediately causes Vata, Pitta, and Shleshma, the 3 doshas, which are Ashaya Gata, going in their normal ashayas, or moving in their normal organs, the normal sthanas, which are Urdhva Mashaya for Shleshma, Grahani area for Pitta, and Pakwashaya for Vata. So these doshas that are already present in those normal locations are going to undergo this thing called ati prapidya, too much or excessive feeling of squeezing. It's almost like if you ever played with those balloons, you know, those blow-up balloons that you make blow-up balloon animals out of, and you squeeze them, and you twist it, and you turn it, and you make a horse, or a dog, or a cow. They all kind of look the same. So that squeezing effect is what happens to these doshas in their natural sthanas when a person consumes too much. This excessive pressure creates this manaha sarve yugapat prakopanam or prakopam apadyante. All of these doshas undergo aggravation from their normal state. So they're in, let me see if I can. So you have ati matra, the term he used was ati prapidya. So this comes from a term called pidana. Pidana means squeezing. Squeezing or putting under pressure. So this is the sequence that's happening. And then the doshas prakupitastam, in their aggravated state, they've been pushed into the state of prakopa due to ahara rashim, the quantity of the food. What happens is they undergo aparinatam avishya, an incomplete state of conversion. And so this is like parinama, right? A variant of the term parinama. And with the addition of the a prefix, it means it's not getting converted. So this is incomplete conversion, and since we're talking about the digestive system in particular, we could consider this as incomplete metabolism or transformation. Any of these terms would be appropriate for this context. Let's see here. So when they are incompletely converted, they sort of turn into this conglomerated mass. It becomes like a bolus, kind of, like a ball of incompletely digested stuff. And this bolus is moving around inside the gastrointestinal tract. What it does is vishtambayantaha, it obstructs and restrains sahasava with great strength, and it has the ability to go in either direction, up or down. So it causes obstruction, going in the upward route or in the downward route. And suddenly, once it becomes unrestrained, it can produce a whole bunch of disorders as a result. So what this means is that if we were to think of this on a timeline, time scale. And we call the beginning here day 1. Let's say noon. And this is lunch. And the person has atimatra. So some amount of Āma forms. And this Āma is localized immediately in the koshta because it's acute. So we call it koshtagata Āma. This Āma goes on living in the koshta for any number of days. This could be day 2. This could be day 3. We could go all the way out to like day 30, let's say. Depending on what the person does over the next couple of days, this koshtagata Āma is either going to be expelled from the body, which is the ideal scenario, or it's going to be reduced in size, or it might stay the same, might stay in its location, or it might move somewhere else, or it might increase. Any number of things can happen, and what happens, or what the outcome of this is, all dependent on what the person does in the next few days. If they continue to indulge in atimatra, they eat too much, then most likely this Āma is going to continue to increase. Most likely it's also going to start moving around in the body. This is the more dangerous situation, of course, because this is what produces lakshanas. So we get lakshanas of discomfort. And in the first day, the lakshanas that we're going to see might be samanya Āma lakshanas. As we creep into the next couple of days and even go further, if the person continues to have atimatra, we're probably then going to start seeing sama lakshanas. And once this Āma and sama components, once they continue to gain strength and it pushes out throughout, the course of a month maybe, of atimatra, or of compromised state of Agni, this comes out of the koshta and it moves into the dhatus, and that's when we have dhatugata Āma. So it's a process. It doesn't all happen all at once. And depending on which kinds of lakshanas are present, which kinds of lakshanas that you see present in a patient or a client, that is going to give you information on where they are in the process of Āma development. One of the easiest ways to sort of test this quickly is if you want to do a differential diagnosis. We'll call this DD for differential diagnosis of koshtagata Āma versus dhatugata Āma. There's a couple things to know. One is that what is the time required for pachana? In koshtagata Āma, the time required for pachana is 3 days. In dhatugata Āma, it is more than 3 days. What are the types? Oh yeah, go ahead.
So when you're talking about pachana, you're talking about just to digest like one meal?
Good question. When we're talking about pachana here, we're talking about Āma pachana. Thank you for asking that, Julie. I forgot to mention that. This is Āma pachana. Āma pachana is a specific process, a specific protocol that is meant to... Whoa! Sorry, guys. What was that? That is meant to interrupt the process of Āma formation. So where we have a simplified version of this, or the most basic version, let's say, we have atimatra, intake, doshas in their normal sthana, undergoing prakopa, causing that pressure, creating this obstructive mass, which is either going to move upward or downward. This is a very beginning. This is like when a person is clean and clear, and things are functioning normally. This is when this kind of thing happens, this sequence of events. Although the sequence of events can happen at any time, even when the person is already afflicted either with a disorder or with existing Āma, but I'm excluding that from our discussion here because that is a complex scenario, and we have to start with a simple one first so that you can understand and see the sequence. Once we understand this, we'll start adding on layers of complexity. So with this obstructive mass of Āma that resides in the koshta, if we want to get rid of this right away, what we do is we apply something called Āma pachana. That is the protocol that includes using specific dravya, maybe one or more, and specific activities that allow this Āma to be digested and expelled from the body. It may not undergo complete digestion. It may undergo partial digestion only and then just be expelled. The point is that it doesn't need to undergo digestion. The only thing we care about is getting it out of the body. As long as it does not remain in the body, then it's not going to affect the person. If it does remain in the body, it's going to cause a problem. And even if it does undergo digestion, it's not really going to provide any type of beneficial nutrients or help to the person's body physically. Imagine if you had, you want to make chocolate chip cookies one day and you make a big batch of chocolate chip cookie batter and you get all excited and you make a whole bunch of cookies, but you made so much batter you still have some left, so you put it in the fridge and it sits there for weeks or months on end. If you go back and you want to make cookies out of that, it's probably not going to be so good as it was the first time. Point is that if we leave this Āma hanging around for a long time, we don't want to digest it really. We don't want to absorb it and assimilate it into the body. We just want to get rid of it. Again, that is a more complex intervention. So what we're talking about here is Āma which has just formed. Then we're doing, then the standard intervention is Āma pachana. Pachana includes breaking down that Āma and encouraging its expulsion from the body. Does that make sense, Julie?
Yeah, that definitely makes sense.
Okay. So, Koshtagata Āma versus Dhatugata Āma. We're looking at the time required for Āma pachana, 3 days in the case of Koshtagata Āma, more than 3 days in the case of Dhatugata Āma. What are the lakshanas that we would expect to see on each of these? These would generally be samanya Āma lakshanas. These mean the general Āma lakshanas. It's right there in the GIT. It was a very recent onset. It's not chronic. It's not been lingering around for a very long time. See, when it lingers around for a long time, that's when we see things like samadosha lakshanas. That's when we see things like dhatugata Āma lakshanas. which you're going to say, wait a minute, that's not in the textbook. How come you didn't talk about that? This is Dhatugata Āma Lakshanas is beyond the scope of the essay level. You're not going to, we are not going to go through these. If you want to go through them on your own, you can. It is Charaka Sutta Dasana, chapter 28, but I would not recommend it until you get through everything else first. It's not going to make any sense, and you're not going to be able to use it clinically at this level. You just need to understand that these exist, and that if they are present, this type of case is a more serious case, a complex case, and this has to go to an Ayurveda Acharya. Things at the Samanya Āma level are the SA level. Samadosha can also be SA or AA, depending on other factors in the assessment of the patient. For example, if it is a young, otherwise generally healthy person with no other complicating factors, and they have access to all the formulations of medicines that they need, they have access to adjusting their schedule and prioritizing what they need to do for their health on a daily basis, you know, that kind of thing makes it an easier type of case to manage, and so an SA would be able to handle that type of thing. If it were outside of that, and you know, they weren't afforded all of those types of things, or any other complex issues are present, then it should go to an Ayurveda Acharya. So this is kind of the practical application of Āma. And this is the sequence of how Āma is formed. And notice that Charaka talks about this in the context of Ati Matra. So, like, is it a clear-cut line where every time somebody eats too much they have Āma forming? Or maybe sometimes it's okay, maybe it's not okay. Very frankly, everybody has some amount of Āma forming almost all the time. So we have to just kind of be ready to accept that fact, and more importantly, ready to expect it in clinical practice.